Okay, so we're doing a IV piggyback infusion. First thing I do is identify the patient, make sure they don't have any allergies, and check the MAR for an order. Looks like this patient has an order to get IV penicillin today to treat a urinary tract infection. So penicillin is an antibiotic. It will inhibit bacterial growth. We're going to give a dose of 1,000 milligrams per 5 mLs, and we're going to mix that. We always want to check the patient to make sure they don't have any allergies, any sensitivities to the medication. Always monitor them for nausea, vomiting, or any seizure activity. I would wash my hands, and then I will reconstitute my medications. I would check the expiration dates on everything and make sure that everything is still okay. So we're going to pull out 5 mLs of solution. This is our sterile water. There's 3 mLs. We'll put it into our medication. And then we need another 2 mLs because this is only a 3 ml syringe. Okay. I would mix my medication, make sure it's all dissolved. And then we can go ahead and clean off our bag and we would add it to our IV solution. An alcohol wipe. Draw out my 5 mLs. And go ahead and put it right in here. There's 3. And I'll have to do 2 more since I have a 3 ml syringe. Okay. Okay, so our medication is reconstituted. It's already in the bag. I would go ahead and put a label on it. On here I put the additive that we have penicillin, 1,000 milligrams per 5 mLs. We're going to be running it at 50 mLs per hour. I'll write the patient's name, their date of birth, the expiration date of the medication, my initials, the date and time that we started it. So go ahead and put that on the back of the bag. And then we'll go ahead and spike the bag so that we can get ready to hang it. Okay. Okay, so I would squeeze this and fill the chamber, and I can open up the roller clamp to make sure that there's the solutions in it and there's no air bubbles. So I'll do that. Okay, so we have no air bubbles in our line. So the next thing we're going to do is go into the patient's room, let them know we're going to start their antibiotic. Of course, identify the patient and assess their IV site to make sure there's no swelling or any signs of infiltration or redness. The next thing we'll do is pause the current pump because we already have 100 mLs running of normal saline, 100 mLs per hour. So we'll just go ahead and pause the pump. And we can hang our bag. We're going to move our primary bag lower than our secondary bag. The next thing we'll do is alcohol wipe the port before we hook it up. We can attach it. And then we're going to program our pump for a secondary. We're going to choose our medication and our flow rate. And we're going to do 50 mLs per hour. Give our flow rate of 50 per hour, and then we can press start. We're going to open up our clamp, press yes, and the pump should be going. So we'll know that it's working when we, where are we? That we see that our bag is dripping. And that there's no signs of infiltration at our patient's IV site. We'll check on him and monitor him for signs of symptoms of a reaction.